Cynthia is here. Hi, Cynthia. I hope 30 minutes, maybe even 25 minutes is good for you, because the topic that I'm going to run, it'll be pretty, I want to give it enough time. So, all right, Al, you have a question?
Yes, thank you. I figured I'd unmute for this one because it might be too much typing. But this is actually concerning a topic that you brought up last week regarding natural herbs and antivirals, to help with strengthening the immune system, especially, now in the fall when we have these recurring waves of COVID and RSV and flu and all these things. And you touched on also the video about how to help with things like chronic EBV and HSV1 and things like that. So basically my question is, there's so many different herbal antivirals out there, right? There's, you mentioned L-lysine, but there's also things like olive leaf. There's things like reishi mushrooms. There's all these different types of anti-herbals that I guess are better for certain things than other things. If you had to take one good, I guess, all-purpose antiviral for a time like the fall when there's so many of these viruses out there and you just want to strengthen your immune system against all this, which one would you take? And then also, which one do you think, in your opinion, is better for something like more of the chronic stuff, like chronic EBV, for example?
Okay, so you're right. It's not an easy question, but I'll try to handle it. So let me first backtrack for a second. There are different points here. You can take a direct antiviral. So if you're taking a lysine for herpes infections, it basically is a direct antiviral. It doesn't do anything to your immune system. It directly blocks replication of the virus. You can also take direct antiviral or antimicrobial herbs. So you mentioned olive leaf, something like berberine. So there are some direct antimicrobials. My favorite one, if you were to take one, and a lot of you know me, so you know what I'm about to say. In fact, let's see who gets this right. So if you were to take one direct antimicrobial, what do you think that would be? Just one, not like a cocktail, but just one, simple, cheap, history proven. What would that be? Come on, you guys know me. Elisa is showing something. I have no idea what she's showing. Just unmute yourself and speak, because I can't, like, that doesn't mean anything to me. You have to unmute yourself. All right, anybody else who wants to venture and say it?
It's D or C.
No. No. Remember, I just said that. It's a direct antiviral. So literally it will kill or suppress replication of microbes.
Make it a multiple choice.
No, let me give you a hint. It has something to do with bees.
Oh.
Of course. Okay.
Of course.
Yeah.
All right, so propolis would definitely.
Bee pollen.
No. Bee pollen. Propolis would definitely be my favorite choice for many
Honey?
reasons. Well, it's really a propolis. The honey itself is not strong enough. But yes, I mean, you can put honey directly on the wound and it would work. But if you were to pick something stronger as a direct, let's say you get sick and you're trying to boost immunity, but also use something, definitely a tincture of propolis, taking it internally in a small amounts. You can mix it with drinks. You can take it directly. I do a lot of gurgling and like an upper respiratory, like if you have a sore throat, swish and swallow. If you have a nasal passages infection, you can do neti pot with some propolis. Sometimes I tell people to tea true. So that would be my favorite, like one antimicrobial. Now, if you think about the immune boosting, it gets more complicated. Here's why. Because there's tons of agents, and I don't really think one agent's going to stand up and fix anything. You really need to take cocktails. That's how think of it this way. We interact with an environment in the way of multitudes of different things we take. We eat diverse food. It doesn't make sense to just pick one herb. And I wouldn't even think that there would be one, because it really depends on your personal situation, depends on your constitution. What is good for one person is not going to work for somebody else. I do love mushrooms. You only mentioned one. I forgot which one. I think you said. Which one you said? shiitake, I don't know. So the mushrooms, definitely a mix of mushroom ratio. Thank you. The mushrooms could be a very good mix. It's not CME, I can say that. I like Host Defense. I use several of their products. My Community is one that I really recommend. It's a little pricey. Also there's a Stymets 7 is very good. So for the against chronic EBV, this is going to be a little out there in the left field. If you just have EBV and it's chronic, I would use homeopathy. I would use homeopathy as a first line. I would use a constitutional no-zone homeopathy. It's just called, I think it's just called EBV. And that's what I would do. And the reason for that is this. You're not going to suppress EBV directly with anything that would be very safe, because if you're going to use drugs, which some people try, they have side effects and you take it for a long time. If you're going to take any herbs, it's not going to work either very well, because honestly, I think you have to take a cocktails. They're going to be long-term intake. I'm not sure I like that. That's why I would do homeopathy. And also, again, it terrain-wise, right? So you want to enhance the terrain. So if you know your infection, you could go after it with homeopathic if it's chronic. So people put elderberry, elderflower, honey, and all that. Yeah, it's good. All these things are good. But remember, try to make them into cocktails, because we don't just take and fix things with one approach. It's very different from taking a particular antibiotic for some infection, where you know the level of efficacy. You can rely on this. With herbs, it just doesn't work that way. You have to think more globally. You have to continuously support your immune system. You could use different things on a different basis. Like you can, but that's where also gets more sophisticated. If you don't know your terrain, it's going to be harder to recommend something. So those things that I said are a bit more broad. Like the propolis probably doesn't matter what your terrain is. It will serve as a one-time microbial. We can continue with this topic if you guys find it interesting. I had something different prepared, and I do see that there are questions. So I'm going to continue with the questions, and we'll see where we end. We heard there may be a new vaccine in the fall that will address. Yes, that's what we're hearing. We shall wait to get the vaccine, even if we are traveling this summer. Okay, very good question, Mark. This is important. So here's my take on this. If you're going to have a complex traveling system structure and you're afraid of getting your schedule altered and canceling it, et cetera, and if you're more than 6 months out of the prior booster, I would get a vaccine, and I would sort of just see what happens in the fall, because it's not really clear what exactly going to happen in the fall. We don't know if they will make that vaccine on time. We don't know if it's going to be, we don't know anything. I mean, the virus continues changing. You remember what happened last year. It was a bit more rushed at the end. It's hard to actually say. Now, if you're not planning on traveling, you've had the vaccine, let's say, earlier in the year, I would wait till the fall for sure, just because I would give it at least 10 months from the prior vaccine. So I hope that's helping. Okay, so what if you're not a coffee drinker? Is the coffee drinking or having it some other form? So nobody knows. There are coffee extracts without caffeine, but the thinking is that, believe it or not, it's actually a mix of caffeine and the flavonoids and the dark color, the tannins in the coffee that are the beneficial ones. So it's not that simple. Point being, caffeine seems to have some direct health benefits, but only in people who are able to effectively tolerate it. Obviously, there is no benefit if you're jittery and very anxious and stressed by drinking coffee, so you shouldn't be consuming it. What I was mentioning is that there's a really clear data nowadays that coffee, at least 3 cups a day, so basically 4 cups and more, 3 plus, seems to have a significant benefit for risk of Alzheimer's and Parkinson. The risk decreases quite a lot, nearly 20–30%. So it's a very significant drop. Now, of course, all these studies are what's called observational. They're not actual. It's very difficult to do a study on dementia, because going forward, it's going to take decades to look at the effective collection of the risk. So nobody does that. They just look back at the data. So there's some problems with all research like this, but nonetheless, this seems to be consistent from one study to the next. Okay. Okay, so there's a question. Cecile, you have to look up CDC and you have to talk to someone. I can't answer that question. I will refuse to answer that question. The problem here is somebody's asking, Cecile is asking, what immunization patients should get going to Ghana. You have to first assess the patient's risks. Then you have to go to CDC website and figure out what is recommended, and then healthcare practitioner needs to make decisions. So unfortunately, I can't answer that. I strongly recommend for your friend to go and see someone. Actually, it's required. I will tell you, most likely she will need a yellow fever vaccine, or else they would not let her inside the country. Most of the time, it requires for most of African countries. But again, I'm not going to state that I know this. I do significant amount of travel medicine for my own patients, but I always have to look it up. It's also constantly changing. So that's another thing. Some recommendations may be okay today, and then in 3 months they'll change them. So you have to really stay on top of it with the CDC website, but it's pretty straightforward. Okay, banner bees and DuPont Circle Fresh Mark. Yeah, so the honey propolis. Oh yeah, so right. So that's one way to do this. You can literally just get a propolis mix already into honey, but I actually recommend getting propolis tinctures. They're very low cost. They're way more concentrated. You don't need to take a lot. You don't have to mix it with honey. You can mix it with anything. So Al, I'm presuming you're asking about coffee, right? The polyphenols in coffee. So it turns out when they tried to isolate it, the effect was not as good. And nobody fully understands why. That's why there's a belief that caffeine does have benefit. But yeah, so if you're completely against the coffee, you can get a couple of things. You can get a green coffee bean extract, and you can get regular coffee bean extract. So like what Al is saying is, like, you can concentrate polyphenols and flavonoids, and you can like basically take that. It definitely would be better than probably doing nothing, but it's also will be a supplement. So I'm not sure if just making a point. Okay, now I want to do a time check. It's 2:20. Let me tell you what I had prepared, and then you guys tell me what you want to do. So I prepared to cover in certain number of slides data from our ReCode program, and also give an update on the light therapy. I don't think I can do it all in. I don't want to take more than 5 minutes from Cynthia unless she tells me to take more, but I don't want to do that. So we have tops of about 14 minutes. So what I can do is I can give you an update on light therapy, show you a couple of things there, which will be probably 5 to 10 minutes, and then reserve for the next week or week after to do more of ReCode. So that's our cognitive decline reversal of cognitive decline program. So I can give you a whole presentation on that. I can also just highlight a couple of points. And actually, let me do this. I'm going to give you a couple of highlights of the program itself. And then I'll give you a link to the video that I just recorded. And then, okay, so Jennifer made me swing that way. All right, and then we'll do 40 hertz a little bit later. The reason 40 hertz is we got our paper accepted yesterday. So now it's public. I'm allowed to discuss whatever the results I want to discuss since it's already accepted. So you're actually getting the data before it's literally published, even though it's already accepted. But I'll do that in the next week or two. There's no rush for that. But meantime, let me share my screen in a second, and I will go. And while I'm looking for the slide deck, Cecile, the coffee needs to be organic. Which particular type? Decaf has less benefit compared to the regular coffee, but it still has some. Rosen literally used the term, it's 50% less effective. I don't know what he's basing it on, but nonetheless. Okay, so you should be able to see my screen right now. Can you see it? I hope you can see it. I don't.
Yes.
Okay, good. I'm not gonna show all the slides. I'm gonna skip through things. Now at this point, we have more than 60 patients. I will show you data from that. I'm gonna skip this. This is just like, you've all known this. If nothing, by the way, if nothing gets done about dementia, it will be by far the most prevalent illness on earth. It will be by far, it's already most expensive. It's now the most expensive disease in the United States of America. It's projected to be more expensive than cancer and cardiovascular disease combined if the trend doesn't change. So it's a massive expenses. It is incorrect to think of it as a sixth leading cause of death. This is an official data. It's actually a lot worse than that, because this it only includes direct links, direct causes of death where you can attribute it to Alzheimer's. People with Alzheimer's die way earlier from complications of infections and all other things, and that is not included in this number, but it should be probably. But that's just how they do statistics. So I'm just gonna skip all this. But I do wanna read this to everybody. So in 2016, there's been a significant shift in awareness of the fact that really we have to use multimodal, basically integrated and integrative approaches for Alzheimer's, simply because single interventions have failed. And this is the commissioner of FDA who basically saying, look, enough is enough, all these trials, even the most recent medications for Alzheimer's, they're approving them because there's no better drugs, but that doesn't mean they do anything. In fact, I would nobody in my mind, nobody in their right mind should be using the newest drugs, the ones that biologic agents for removal of the plaque. They are basically nearly as dangerous as any benefits that you can get out of them. The degree of benefit is so small, and degree of side effects, including death, is so significant that I just can't figure out who in the right mind will take that risk. But I guess some people are willing to do so. So basically, I've already talked a little bit about this. There's a lot of modifiable risk factors, and this is what the treatment is concentrating on. And in addition to kind of a way of thinking about this is really to separate things in categories. This is how Bredesen program works. So you have this types of Alzheimer's disease. You know, it's a way of an attempt at positioning the classification in a way that it makes it comfortable to work with. So you got all these types, and then you go after each particular problem. And each given patient will have certain risks that are going to be more than others. And so, the computer will prioritize, will generate a report for us. And we will look at this and say, okay, well, in this particular example, from top to bottom, so the highest risk is hormone loss, and then vasculature, sugar, inflammation, and then there's no trauma, and toxicity is the last. In this particular case. And so in each case it varies. And then we'll treat each underlying driver with particular either lifestyle, diet, supplements, sometimes even medications. So this is a back from 2018. We had 3 of our patients in this cohort presented. This was the first article. And then the more recent data comes from a study that was published last year. And this is 25 patients. Now, there's no control here, but this was a prospective study, and they did apply 100% of the program to these patients, and they paid for them. So that adherence here was 100%. They actually basically just excluded people who couldn't follow from analysis at all. So you're just looking at this 25 patients, everybody finished everything, so to speak. And, you know, results were dramatic. 84% of people with Alzheimer's improved. Now, if this would be a drug, there would be 0. Nobody improves, right? Everybody gets worse. With drugs and the standard of care, it's not about improval. It's about, can you slow down the rate of decline? Here you have 84% improved, 4% no change, and only 12% decline. But again, these were patients who followed everything. They were pretty young. So 70 is relatively young. Our average population in our clinic with Alzheimer's is much older. So I'm going to skip some of it. This is the real data from a general ReCode. So this are the patients who are not in a trial and they're just looking at their statistics on their end in the software. And this is very similar to what we're observing. In fact, it's almost identical, as I'll show you in a second. Oh, and the program is very complicated, if all in all. So yes, it is not walk in the park, lots of supplements to take, a lot of diet modifications. Not everybody on keto. Some people can't tolerate keto, and that's fine. And then there's other versions of the diet. But everybody gets all their drivers addressed. Everybody gets biologic dentistry. Everybody gets some kind of a neurostimulation. Remember, we're going to talk about 40 hertz. Bredesen recommends V-Light. I find it extremely cumbersome and very expensive. So that's why we really prefer 40 hertz, since it's free and much easier to use. And so, yeah. And this is our data, and that's where I'll end. So, notice that the patients are a lot older. Some of our, like an average in ApoE4 group is 80 actually. So it's way above what there was. And if you sort of put it all together, the average age is way past 70, kind of closer to 75. So much older than the, so you can see the results. 75% patients who had who improved had ApoE4. And this is very consistent with what Bredesen is in his group is observing. If you have an ApoE4, you're in a great position to get a lot better, basically reverse your Alzheimer's permanently if you stick with the program. You know, I find that as you can see that the total statistics, if you look at us, that 73% either improved or didn't progress. To me, not progressing is a strongly positive result, because I wouldn't expect that with medications. I would simply expect slower progression with medication, but not no progression. And so, yeah, and a very high dropout rate, half. And you would expect that. In a real life, people just can't stick. It's too complex of a program. They have to have caregiver. We're trying to figure out how to optimize that, but it's very difficult to do so, because you know, if you have unlimited resources and we can support the patients to do everything, that's different. Unfortunately, that's just really not feasible. The program is expensive. So I think, let me show you these two cases just to give you a bit more specific idea how that works. And then we'll see if we have a question or two. And that's all the time I have. So this was our first case that did extremely well, despite being in the early 90s. But he had only one key driver, which was mercury toxicity. Is really rapid improvement, a dramatic improvement. Basically, he went from mild Alzheimer's to no Alzheimer's in 6 months, and the age of 90 plus, right? So unfortunately, he did pass later from strokes, and I'm sure it has to do with the toxicity. Unfortunately, mercury causes all kinds of issues, not just memory loss, but also vascular problems. So it's probably had to do something. But you know, but also like you have to think about this in retrospective. This is not, I'm not saying that we give this gentleman a lot of years, but we did give him some quality in the end. So here's a case that's much more typical. So patient who does have ApoE4 and multiple drivers, so inflammation from mold and mercury. My estimation is about 2/3 of patients are toxic with Alzheimer's, roughly. That's so anybody with Alzheimer's have to have a toxic workup. That's the way I think about this. She also had some hormonal problems, including low thyroid. Homocysteine was elevated, which is a typically measure of toxicity, sometimes not necessarily, and then also high sugar. So this is very typical results. So basically complete resolution of Alzheimer's within about, what was it, 6 months. She got about, you know, some improvement, and then now 3.5 years later, she's basically normal. 26 would be considered borderline normal, and she's stable. And this is, you know, it's really nice to see when people were not able to read and drive, and now they can do this again. So those are the things that we're observing. They're not common. This is a more of a really good response. Typical response, as you saw from this slide. Let me go back. You know, it's a partial response. So some people here will not go all the way to 20 to 30. They'll go up to say 26, 25, and they'll stay there. It may not be completely normal, but it's still a lot better than you would expect with the current standard of care. This is the case this case. So that's actual case in detail. This 91-year-old gentleman. If anybody interested, I'll give you a link in a second to the much longer presentation that has all this. And so you can also go back, and also the video has links to the study itself, to the case report. So you see how toxic he was in mercury, both organic and inorganic. And then as we treated him, he's completely resolved this toxicity, and at the same time, he had a marked improvement in cognition. So that is all for this. It's 2:34. We have time for one question, if anybody fancies. So Sheila.
Is there any protocol analysis, someone you can work with before you actually get the Alzheimer's throughout, you to say, start doing life like this, and then they can, you have a baseline, and then 5 years later to check. Well, what is that? And who is that?
So there's a program called ReCode, which is reversal of cognitive decline, and there's a program called PreCode. So this is before you develop cognitive impairment. So you start sort of preventing it. So I'll give you guys a link to the video. All these links to both programs in the video. Do take a look. And if you have more questions, let me know. And I'm happy to revisit this issue longer at some point in the near future. That would be not difficult to do. So
Thank you.
Sure. And Cynthia, thanks so much for being with us. Welcome.
My pleasure.
I'm sure we are in for a wonderful practice.
Thank you so much. Hello, everyone. And for those of you who may not be very familiar with meditation or might want a refresher, meditation is a mind and body practice that has a long history of use for increasing calmness and physical relaxation, improving psychological balance, coping with illness, as well as enhancing overall health and well-being. And mind and body practices, as you may already be aware, focus on the interactions among the brain, mind, body, and behavior. And there are many different types of meditation. However, most have 4 elements in common: a quiet location with as few distractions as possible, a specific comfortable posture, and this can be sitting, lying down, walking, for instance, a focus of attention, which could be a specially chosen word or set of words or an object or sensations of the breath, and an open attitude. So letting distractions come and go naturally without judging them, or at least not bringing harmful judgment to them. So what I'd like to share with you today is called the mountain meditation. And this is an adapted version from Dr. Jon Kabat-Zinn. Dr. Kabat-Zinn is the founder of the mindfulness-based stress reduction program, University of Massachusetts Medical Center. So as we begin, I'm going to invite you just to be in a comfortable position. It could be in your current position, or perhaps you would like to shift your posture in some way. Just want to be comfortable yet alert. And once you're in that chosen posture, I'm going to invite you to take a few full breaths. And just tuning into the breath and the body. So not needing to think about the breath, you're just tuning in the sensations of breath, noticing where you feel the breath within the body. And this could be mostly within the abdomen or the chest or the throat or the nostrils. Just tuning into where you feel that sense of breath most succinctly. And you don't need to change the rhythm of your breath. You can just keep it at its natural rhythm. So our breath and our body are always in the present moment. Something that we can always turn to if we're wanting to feel a little bit more centered and a little bit more present. So the invitation is to close your eyes or gently lower your gaze if you haven't already. And just allowing the body to be still. And the invitation is also to sit with a sense of dignity, a sense of resolve, a sense of being complete in this very moment. and your posture reflecting this sense of wholeness, this sense of being complete, just as you are. And as you sit here or standing or lying down, picturing in your mind's eye as best you can the most beautiful mountain that you know or have seen or can imagine. And just holding the image and feeling of this mountain in your mind's eye. And letting it gradually come into greater focus. Observing its overall shape, perhaps its lofty peak high in the sky. Perhaps there's a large base rooted in the Earth's crust. And perhaps the mountain in your mind's eye has steep or gently sloping sides. And just noticing how massive this mountain is. How solid, how unmoving, and how beautiful, both from afar and up close. So perhaps the mountain in your mind's eye has snow at the top and trees on the lower slopes. Perhaps it has one prominent peak, or a series of peaks, or a high plateau. Whatever its shape or appearance, just sitting and breathing with the image of this mountain. Observing it, noticing its qualities. And when you feel ready, seeing if you can bring the mountain into your own body so that the body sitting here and the mountain in your mind's eye become one. So that as you sit here or stand or lie down, you share in the massiveness and the stillness and the majesty of the mountain. So you have become the mountain, rooted in this posture. Your head becomes the lofty peak, supported by the rest of your body. Your shoulders and arms are the sides of the mountain, and your legs are the solid base, either rooted to the chair or to the floor. So you're experiencing in your body a sense of uplift. And with each breath, becoming a little more like a breathing mountain, unwavering in your stillness, completely who and what you are, and beyond words and beyond thought. A centered, rooted, unmoving presence. Now, as you sit here, becoming aware of the fact that the sun travels across the sky and light, shadows, colors are changing virtually moment by moment. Night follows day and day follows night. And there's a canopy of stars and the moon, and then the sun. And through it all, the mountain just sits, experiencing change in each moment. So constantly changing, yet always just being itself. It remains still as the seasons flow and as the weather changes. And calmness abiding all that change. And in any season, spring, summer, autumn, or winter, it may find itself at times enshrouded in clouds or fog, or pelted by freezing rain. And people may come to see the mountain and comment on how beautiful it is, or how it's not a good day to see the mountain. However, none of this matters to the mountain, which remains at all times its essential self. Clouds may come and clouds may go. The mountain's magnificence and beauty are not changed. At times, the mountain is visited by violent storms, buffeted by snow and rain and winds of incredible magnitude. And through it all, the mountain continues to sit, unmoved by the weather, unmoved by what happens on the surface. And in the same way as we're in meditation, we can learn to experience the mountain. We can embody the same unwavering stillness and rootedness in the face of everything that changes in our lives, over seconds, over hours, and over years. So in our lives and in our meditation practice, we constantly experience the changing nature of mind and body and of the outer world. We have our own periods of light and darkness. And certainly we experience storms of varying intensity that impact our minds and our bodies. We endure periods of darkness and pain, as well as moments of joy and awe. Even our appearance changes constantly, experiencing a weather of its own. So by becoming the mountain in our meditation practice, we can link up with its strength and stability and adopt it for our own. We can use its energies to support our energy, to encounter each moment with mindfulness and equanimity and clarity. It may help us to see that our thoughts and feelings and any preoccupations, our emotional storms, daily things that happen to us, are very much like the weather on the mountain. We may tend to take it personally, but its strongest characteristic is impersonal. It's important to keep in mind that the weather of our own lives is not to be ignored or denied. It is to be encountered, honored, felt, known for what it is, and held in kind awareness. And in holding it in this way, we can come to know a deeper silence and stillness and wisdom. Mindfulness is truly tapping into our own inner wisdom and guidance. And before we bring this practice to a close, there's a quote I'd like to share with you from Mary Oliver. And the quote is, "Tell me, what is it that you plan to do with your one wild and precious life?" So as we start to bring this practice to a close, the invitation is to bring some gentle movement to the body, perhaps wiggling the fingers and toes, just moving the body in a way that feels right for you, opening your eyes whenever you're ready. And I appreciate this opportunity to be with you all. And I turn it back to Janet and Dr. Kogan.
Misha, are you there?
Thank you. Thank you so much. Cynthia always puts me to sleep, so I have to wake
In
up
the
now.
best way, Cynthia.
In the best way. All right. Well, we actually a couple of minutes early. So if anybody have any last questions, let me know. The video I put inside the video, since Sheila's asking me this, if you go to the links at the description, you will find the links of all sorts to the to the Apollo itself, and that's where you find the pre-code information. Janet posted next week we're gonna have Niall, who's been with us lots of times before, and our own Yael, who's gonna talk, probably gonna do Reiki, I'm presuming. But Yael has lots of different hats, so I'm not exactly sure what she's gonna do. Al, you have a hands up? Is that a question?
Yeah, just quickly, Doctor, you mentioned as part of the ReCode a while back, and maybe I got confused. There was a light therapy and a sound therapy, right? So the 40
Correct.
kilohertz, the 40 kilohertz is the sound therapy. There was also a light therapy that you said
That's also 40
you could
hertz
use with
therapy.
with an iPad or something like that, right?
Correct. That's you've
Okay.
got everything right. So I'll put the link for that for now if you guys dying to watch something, but we will do a whole session on that. But yeah, I have a whole video. I'm gonna do another update video the moment the study is actually in print. So probably 4 weeks from now, I'm guessing. It's kind of hard to say exactly. But yeah, we'll do that. That's actually quite popular video it's one of the more popular videos on my channel. So I'm putting it on as we speak in there. And again, it's going to be slightly updated when I do the talk, because the study will have some additional information. So, all right. Well, I guess with that in mind, we'll see everybody next week. We have one quick announcement, and it is we decided, Janet and I, we're going to take 2 weeks off. That would be the last week of July and the first week of August. Just to give ourselves a little vacation, and also I think, yeah, but we think you all gonna come back, right? So on those 2 dates, we will not have Friday PM get together. Other than that, everybody have a great weekend. It's a long weekend, so do honor our history, Juneteenth, and it's an important, I don't want to call it, it's not a, it's not like a vacation, right? I mean, it's a memory day, so we'll honor that. So,
Happy Freedom Day, everybody.
yeah, that's good. I like that. Let's say it that way. I love it. Bye, everybody.
Take care, everyone.